Hey, hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. I hope you're having a great day, a great week, wherever you are in the world. Thank you for joining me for this video. Today, I'm going to talk about alcohol-induced dementia. Alcohol-induced dementia is on the increase. In the United States, approximately 6.5 million people have alcohol-induced dementia. It's called Wernicke-Korsakoff syndrome. In the UK, there's around about 1.5 million people living with this kind of dementia. And it's believed that it's underreported because some symptoms are very mild and they don't always go on to become a big issue. So we believe it's underreported. What is it? What causes it? Well, Wernicke-Korsakoff syndrome is split into two things. And there's a mild side of it, and then there's a more progressive side of it. It's due to a lack of thiamine, which is vitamin B1. Because people drink so much, or because their dietary needs are not met properly, so it could be due to eating disorders as well, or chemotherapy, that also induces this kind of syndrome. Because the vitamin B1 is not being produced, it leads to the brain damage, it leads to the dementia type symptoms. So let's just break that down a little bit into Wernicke's encephalopathy to start with, and that is the milder form of the disease, and it's kind of impacts on, got a list here because it impacts on that many things, but the important things I want to talk about are degenerative brain disorder. So because the disease impacts on brain, and we all know that when we drink alcohol, it impacts on the brain, it impacts on brain cells. Even if we have a small drink, even if we have a glass of wine, and there's some conflicts here because some people will say a glass of red wine a day is great for the brain. Really, you need to drink gallons and gallons and gallons of red wine to have a good positive impact on the brain, and then you're having a negative impact on it. So it's like a double-edged sword, really. So even a small amount of alcohol can do severe damage to the brain. So that's one of the causes. It leads to degenerative brain disorder and dietary deficiencies. Prolonged vomiting can also cause this syndrome, which is very strange, isn't it? That prolonged vomiting can do it, because we are, with vomiting, we are getting rid of a lot of our nutrition. We're getting a lot of stuff that's sitting in there, a lot of our vitamins, a lot of our proteins, and a lot of our nutritional values and benefits are ejected through prolonged vomiting. So that's the main cause of Wernicke's encephalopathy. But it's the alcohol-related issue that I want to deal with, because people are drinking so much alcohol today. Lifestyles have changed. People drink alcohol more or less every single day. There's lots of different types of alcohol available now. It's not always pure like it used to be. You could go to the pub and have a pint, and you'd have a couple of pints of bitter, lager, mild, whatever it is that you go and drink, and things would be okay. But today, there's all kinds of different stuff, and there's one of the things that concerns me is the alcohol that is mixed with soda, because you know my views on soda. So if we're combining soda and alcohol, that's really going to be damaging, isn't it? So we have to think about that, and I want people to cut down. I want people to cut back on the amount of alcohol and the type of alcohol that people drink. We see more and more younger people presenting with cognitive issues, with memory issues, with mild cognitive impairment that very often leads to Alzheimer's disease or one of the other types of dementia. So really think about that. Think about how you can reduce your risk of developing that. Now, if we have 6.5 million people in the United States who have this kind of dementia, and we have around about 5.5 million people with Alzheimer's disease in the United States, it tells you a bit of a story, doesn't it? You know, if we're looking at more people who have alcohol-related dementia than we do with people with Alzheimer's disease, it changed the statistics around a little bit. And the main age group that develop Wernicke's, Korsakoff's encephalopathy, are between the ages of 30 and 70. So the younger generation who are drinking much more are heading towards that damage to the brain. It causes damage to the thalamus and the hypothalamus in the brain, not so much the hippocampus. The hippocampus is what we concern ourselves with in terms of memory and some behavioural stuff. But the hypothalamus and the thalamus are more about regulating temperature, balance and things like that. So, well, because of that, one of the symptoms of Korsakoff's is hypothermia. Not hyperthermia, but hypothermia. And of course, that ties in with the damage to the hypothalamus. You know, mental confusion, visual problems, all those kinds of stuff that we see, and ataxia, which is difficulty with controlling muscle and balance and movement. So we've got those problems that come with it as well. Now, when it comes to Korsakoff's amnesic syndrome, which is the more severe end of Korsakoff's, it's all the same disease, it's just different times in the journey. And that damages the actual nerve cells in the brain, the central nervous system. And then that was my dog, by the way. He's laid here listening to this little lecture. So he's trying to cut down on the amount of alcohol that he drinks. So he's involved in this. So that's where the damage is. It's in the brain cells, it's in the central nervous system. And so therefore it impacts on people's memory, eventually, long term. And very often it can be reversed. Slightly more men than women that are diagnosed with this type of dementia. And it can be reversed. And this is how we reverse it, guys. We give a good substantial quantity of vitamin B1, thiamine. And then we introduce a really good nutritional diet and adequate hydration. However, the thiamine has to come first. There has to be a build-up of vitamin B1. That's the most important thing, to replace the vitamin, get the B1 going, get the B1 functioning in your system, and then we can introduce a good dietary, nutritional regimen. Thank you, Lynn. A regimen, yeah, and therefore reverse. Sometimes it will halt, and of course, the big one: no more alcohol. Alcohol must cease. No more alcohol. No more alcoholic beverages. Don't use anything that contains alcohol. No alcohol wipes. No, nothing that contains alcohol. Bear that in mind. And then we can reverse it. And there may be some brain damage that might, and very often does, repair itself over time, but not always. If there's some severe damage, then we're not going to be able to reverse that. But we can stop it from getting any worse by following that regimen of good diet, vitamin B1, and there you go. That's what we have in terms of alcohol-induced dementia. It's avoidable, it's treatable, it can be reversible, but the best thing to do is avoid having it in the first place, isn't it? So, when I say to you all, dump the soda, definitely dump soda and alcohol. So, rum and Coke, That's a common drink, isn't it? Rum and Coke. So dump the Coke and dump the rum and drink water or tea. Moderation is okay, obviously, everything in moderation. Most people enjoy a drink, but just enjoy the drink. Just enjoy it occasionally. Okay, that's what I wanted to say. I think Lynn might have a question.
How many patients have you treated over the years in your career with this disease? I can think of a couple.
Yeah.
That I know about.
How many? Ooh. I mean, I take into consideration practicing in the UK and the US. So let's say I saw 5 a year for the past 20 years. So 100. Yeah.
And how successful is getting the treatment to reverse and implementing that, and them going along with it and having success?
Right, exactly. That is the thing. Early intervention, just like any other type of dementia, if we detect it early enough, diagnose it early enough, and put in the right treatment and therapy, and the individual follows through with that, then there's a pretty good successful rate. You have to treat the underlying cause. I mean, why are people drinking so much in the first place? Why is it that people turn to alcohol? If it's not a hereditary reason, which sometimes it is hereditary, if it's not, what are the underlying causes? What are the psychological impacts? What is it? What's triggering it? If we address those issues, because we can maybe help people stop drinking, we can maybe treat the disease, the syndrome, and reverse it. But is the person still having those same issues that caused it in the first place? Why do we turn to alcohol? Why do we need it?
Like you say, replace a bad habit with a good one.
Yeah. Replace it, but actually you've got to have the therapy to address whatever caused it in the first place. And then you can replace it, can't you? So you can replace and have the proper therapy. And the proper therapy here, guys, is just like all the other, my program, my triadic approach of cognitive behavior therapy, brain health therapy, and hypnotherapy, hypnopsychotherapy are ways in which we can manage that situation. There's very little use for medicine, for medication, for drugs, because it's not really going to address much. It's not going to help much. To help people stop drinking alcohol, if they're really struggling to stop, something like antabuse, which is something that gets fitted into your abdomen, and when you go anywhere near alcohol, it makes you feel so nauseous you kind of run away from the alcohol. Something like that will help the person to stop drinking. So that's pretty much all we'd be able to do in terms of medication. Yeah.
So if a person suspects they have, or a loved one might have this disease, what is the professional they should see?
Well, go to your primary physician first and foremost, explain what you think, explain what you believe may be happening, and then ask for a referral to the neurologist or the neuropsychiatrist, and that will happen. The primary should know that anyway to be able to do that. But if they don't, then insist on a referral to neurology.
Very good.
Yeah. Okay. Well, thank you guys. Thank you for listening. This has been helpful. Make sure that you share this video, you tell people about the YouTube channel, follow me on Instagram, follow me on Facebook, and website, drdanielnightingale.com. Just whatever. If you need any help, let us know. We're here for you. Have a fantastic week. And remember, say it with me. And we're going to say it a little bit differently today. So, are you ready? Dump the alcohol and soda.